Outbreak first happened, we were asked to form a team, and it came from a triumvirate of a nursing representative, a manager representative and a medical representative, and we formed part of a cell known as the Silver Cell within the organisation. Initially that ran for 12 hours a day, and in the very early days that consisted of just 3 individuals. It involved a meeting at 8:30 following the operational call within the trust and looking at what our actions needed to be for that day. At 12:30 each day, we had a meeting with representatives from every specialty and division within the organisation that brought a situation report from their services in terms of the challenges they were facing. And we were able to then articulate actions from that report as to how we might progress further in that day and what we needed to prioritise in terms of workload.
And I think we had quite a lot of instruction from national teams as well. So we were monitoring information coming down nationally that was quite directive. Some of the changes that we had to make to the organisation, we had to do really quickly. So some of the flows around the trust and setting up swabbing stations for staff, we had to enact that and pull all of the teams in that we needed to help us do some of those actions.
We needed to make sure that actually as well that our comms got out, because actually some of the decisions that we're making, they needed acting on pretty quickly at a wide scale. So it wasn't just a decision made that would affect one department. It affected the whole of the trust, and not just clinical areas, but admin areas, non-clinical areas, catering, those kind of areas, because we'd almost split the trust into different pathways, and we'd created a yellow pathway, a blue pathway, and various different routes within the organisation. And we quickly needed to make sure that everyone knew their roles and responsibilities within that. So the changes needed to happen at pace, and I was relatively new to the organisation at that point, as was some of my other colleagues in the Silver Cell. But I think what we quickly had to do was build a rapport with each other and work out what our strengths were. It was about using the skills of those individuals within that room to make sure we were making the right decisions, but the right decisions that needed to be made at pace. So we didn't have time to think, let's evaluate it, is it the right thing? We had to make a decision, and we made it there and then.
I mean, it was a very interesting time for all. It was very fast paced with lots of things happening at the same time. It was really good to come together with a team of 3 people to sort of lead that with Simon and Jodie. And I think we all brought different areas of expertise to it, and we worked quite well to sound off each other, to understand if things that we were saying were sensible or not, check each other, keep each other in line at the same time as being able to make very quick decisions about stuff.
So we were there as a massive support for each other. And as time went on, people were coming to us as a support cell as well. So it worked really well.
And I think that the challenge for me was actually I was making decisions that I felt should have been made by more senior colleagues, but it was really nice that actually as a triumvirate we were really able to make those decisions, and we were left with that responsibility. We did have our lines of accountability into exec colleagues for some decision making, but actually we did have quite a lot of autonomy in those very early days because we had to make quick decisions.
It was very interesting for me. I've never been in a situation where you get that much information given to you so quickly and have to make a decision so quickly, and you're making it in the best faith with the best information that you have at the time, and you have to make it then, because also delaying it and not making the decision, it also has an impact. And then it is interesting to understand what is possible and what is not possible, because certainly I've never seen the NHS move at such pace, and being able to speak to all of our colleagues from estates, from different divisions of the trust, everybody had one focus, and that was to get our hospital ready for COVID and treat the patients and staff as best as we could. It was a real eye-opener for me how amazingly dedicated our staff were to that cause, and how you had people in procurement. I think Richard Somerset didn't go home for about 2 months and worked, I don't know what he worked, 13 hours a day every day. He was bringing in stuff at 2 a.m. and everything. Everybody just went above and beyond to try and make the hospital as safe as we possibly could for the patients.
Biggest decisions that we made in those very early days, I think there are 2 that stick in my mind. One was around setting up staff swabbing, because we'd got a lot of individuals that were going off to self-isolate. At that point, there were only Sheffield that was offering a swabbing service. We weren't getting swab results back in a timely manner. And actually, we quickly needed to do something to ensure that we had appropriate workforce within the organisation to deliver care for our patients, and so that majority of our services could continue. So I think setting up the swabbing service for staff, and it was one of the first things that we did. I think one of the second most challenging things that I remember was around having a discussion around what surgical cases we could continue, because our PPE was running out and we had to make a decision as to what PPE we were using in which areas, and actually how many more cases we could operate on and what cases we were operating on.
I think for me it was around the ward move, so where were the safest places to look after COVID patients, and then patients that didn't have COVID as well, because we've got some very clinically extremely vulnerable patients that come to the hospital, and it was about how we moved those wards quickly into the right place. And the added complication around that was around the oxygen supply in the organisation, so understanding where was the best place to put the wards that needed the most of the oxygen supply. So I think that big change for staff very rapidly was a really big challenge.
And we made the decision and then moved them about a week or two later, which would normally take months of planning and having to get staff on side and everything. But we swapped 2 surgical wards with 2 respiratory wards when we realised the oxygen supply wasn't good enough to the top level to supply respiratory. And we also moved the haematology ward, which is full of very vulnerable patients, out away from the East Block to try and get them away from COVID. And that was a huge effort from a huge amount of people. And probably the thing that involved the most different teams, because we had IT saying we could do this, we could do that. How do you get the phone lines? How do you get the computers in? We had estates talking to us about oxygen and doors and things. We had the ward teams themselves working out how they'd move the patients. And on top of the practical decisions, you've also got the emotions, because it's a highly emotional time. And trying to support staff, not just in a sort of practical, can we get you your PPE, can we get you the right kit that you need, but also trying to take some time to understand what they're going through and support them emotionally as well as physically was incredibly difficult.
And I think it was as well preparing for the unknown. So we were hearing around our colleagues that were having a massive surge, around the Nightingales that were opening, and we started to see our patient numbers increase, and we're preparing ourselves for actually we didn't know what we didn't know at that point, so we were always preparing for worst case scenario and thinking outside of the box to make sure that we were prepared. And I'm thinking around preparing areas, having conversations around using rooms for surge capacity that we might never have had to use in normal times. And I think there was often some real challenging conversations around, actually, is that an appropriate area? What does that mean for oxygen capacity? Is it the right area? And it was really, really challenging.
I think the intensity was quite significant for a number of months, but I think as time went on and as the triumvirate got to know each other and work together, it became much more comfortable, and this was kind of what we were doing day in, day out. So those decisions were flowing much easier. And I think the 12:30 meeting that we had with a wide range of people within the organisation were really helpful. We got lots of viewpoints. Those decisions came together much easier once we've got some of the basics in place. So once we'd done the ward moves, once we absolutely understood what our oxygen supply was, once we absolutely knew kind of how many ventilators we had, how many non-invasive ventilators we kind of had a base. So I think the intensity continued for some months, but I think our ability to manage that improved throughout time. And as time went on, we introduced additional members into that triumvirate. We were getting then broader opinions and different ways of thinking as time went on. Some of the things that we've mentioned around ward moves, they're still in place now, so nearly a year later. So they were longer term, and we knew they were going to be longer term. So it wasn't just reactionary decisions that we were making, it was preparing us for the coming weeks, months, and potentially into the winter months. The more information we got from the national teams, we understood how long the pandemic was going to progress, where we would see peaks and troughs in some of those cases. So some of the actions we were taking were longer term to make us able to manage COVID patients and non-COVID patients. And partway through kind of the first wave, we were then looking at how we were going to recover. So some of the elective work that we'd stepped down, how were we able to get that back up and running and get back to some sort of business as usual?
I think in terms of those decisions we made around pathways, so the blue pathway, the yellow pathway, really supported that. And it wasn't just something that we needed to do just because it was there and then, but actually we'd thought around actually what will this mean in 6-12 months time for our surgical elective admissions, and actually what does that mean for a blue ward and a blue pathway. So actually they're in place now, and actually they've supported with our recovery and restore program. It was creating pathways that were sustainable long-term pathways, not just short pathways, and we continue to refine those.
And some of the estates work that we've done is to future-proof the trust so that we are able to manage patients in a different way. And so we, at speed, at pace, we're able to put walls up, doors up, and manage patients in a totally different way to how we've ever managed them before. And they're all still in place now.
And then we entered wave 2, which was very different for me. So the second wave was very different because I think the challenges were around managing the staff and balancing the expectations of the service need versus their home lives as well, and giving them a break and covering for sickness, which was very difficult.
Like Nick said, we had lots of established processes, procedures in place. So we'd done a lot of the kind of planning around how we were going to manage. So the changes to the estate, they'd all been done, so we could just carry on through some of those areas. But the difficulty was staff had already been through this, and having to try and go through it again was extremely difficult. People had seen things that they never expected to see in their career. We were asking people to do different things. We redeployed staff to different areas, which is really difficult. It's okay for a short period of time, but we'd done this for the first wave, and now we were asking people to stay for even longer.
We did deal with the second wave, and I think we dealt with it well, but it felt like we were only just scraping through with our staffing by the end of it. And if it had gone on much further past January, I think we'd have been in real trouble. And then on a personal note, since January, my wife's a GP, so she's now out vaccinating the world. So although I'm now at home a bit more, she's not at home anymore because she's got to vaccinate the world. So it's been a really interesting year for my family as well as my professional life, and it's really made me reevaluate of how I try and balance the two off, and not just me, but also how, when you're asking staff to go above and beyond because you have to ask them to, actually just seeing what impact that has on their lives. I think everybody, and as Jodie said, it's a credit to the staff that have just stood up and just got on and done it.
Would I be prepared for a pandemic again? Would I do things differently? There's always things that you can do differently, but I think as a leader in the organisation, it has really made me evaluate and actually realise the importance of engaging everyone in decision making. But there's been times when I've gone home and have felt physically drained, emotionally drained, and thinking actually this is not what I signed up for. But I think that things that kept me going over the last 12 months is seeing the dedication of Team DBTH in terms of delivering the best for our patients and actually going above and beyond. And I don't ever remember being in that silver cell and people saying, no, I'm not doing that. People just did get on.
Reflecting on the last year, I was relatively new to the organisation, so I had to quickly build those relationships with people in the organisation and gain their trust, really. I think what absolutely amazed me was how accommodating people were to change, how people wanted to do the right thing. I hope we'll never see anything like this again. But I think it's taught us all a lot about who we are as people and how actually working as a team is the best way forward. The divisions between services, departments, they all went. Everybody wanted to do what was needed for the organisation.
Yeah, I mean, I think this has definitely been one of the hardest years of my life. It's been incredibly difficult, and not just professionally, but personally. Certainly that first sort of time in Silver Cell, we were working 11, 12-hour days, 6-7 days a week. So I didn't really see my family. My wife was very accommodating and helped out with the kids and everything, but it was very tough. And that first bit for me, the challenges were around, we didn't have equipment, we didn't have the kit, we didn't have a hospital that was set out in the right sort of way, but the staff were ready to go for it, they were up for it, and they saw it as, let's get this sorted. So we incredibly quickly changed rotas, got staffing patterns, everybody was happy to work 1 in 2 weekends, overnight, whatever. And there was a huge amount of enthusiasm. And I think we harnessed that quite well by getting people involved in actually making it, rather than doing say, this is the challenge, how are you going to come up to that? It was so clear, wasn't it, that everybody from procurement, estates, it didn't matter wwhether you're a doctor, a nurse, a band 2, a porter or whatever, the hospital doesn't work unless everybody is involved. And it really did show that the trust can only work if every single part of the trust is working and comes together, and that every single person in the trust, no matter what role they were in, played their part and played their part amazingly well, really.